अ वेरी गुड मॉर्निंग टू ऑल माय फार्मा फ्रेटर्निटी मेंबर्स। मैं अपने पूरे फार्मा परिवार का इस मंच पे पुनः स्वागत करता हूं और हम अपनी अवेयरनेस की कड़ी को आगे बढ़ाते हैं। और आज का हमारा टॉपिक है ओवरव्यू ऑफ ड्रग इंड्यूस्ड रीनल डिजीज। यह टॉपिक हमारे क्लिनिकल फार्मेसी कोर्स यानी वो कोर्स जो पेशेंट रिलेटेड एरियाज के कोर्स हैं, क्लिनिकल फार्मेसी, हॉस्पिटल फार्मेसी, एम फार्मा, बी फार्मा या फार्म डी रिलेटेड कोर्सेज के अंतर्गत फार्माकोथेरेप्यूटिक्स में एक इम्पॉर्टेंट टॉपिक है। और इसमें इससे रिलेटेड एपिडेमियोलॉजी, मैकेनिज्म्स एज वेल एज द मैनेजमेंट एस्पेक्ट्स पे हम एक ओवरव्यू करेंगे, एक बात करेंगे, ताकि आपको अपने सेशनल्स के लिए, मेन एग्जाम्स के लिए एक ओवरव्यू मिल पाए कि हमने इस टॉपिक को किस लाइन ऑफ एक्शन से पढ़ना है और कैसे इसके नोट्स बनाने हैं। So I welcome you all again and let's start the journey of the drug induced renal disease. Thank you. So today we will start our journey with the background and epidemiology of the event of renal toxicity. Now, the drug induced toxicity usually covers diseases which usually appear or occur after the event of drug administration. Drug induced kidney disease is a disease which affects the kidney after the event of drug administration, and it is the major cause of acute kidney injury or chronic kidney disease. The main intervention or the prompt action which is required for management of a drug induced toxicity of renal origin is that it needs prompt management, related interventions, and even in severe cases prompt hospitalizations are needed to ensure patient safe treatment. Thus, to ensure the patient safety, the main objective is to identify and manage the event of drug toxicity. Now, epidemiology. Epidemiology means the distribution of the disease in the population, in which the incidence shows that this is more prominent in adults within a range of 14 to 26%, and up to 16% of cases are prevalent in pediatric cases. The set of drugs or the drug classes which are the major contributors in the event of renal toxicity includes aminoglycoside antibiotics, non-steroidal anti-inflammatory drugs, contrast agents, and angiotensin converting enzyme inhibitors. Now, in this slide, we will overview the descriptions as well as the mechanism involved in the event of drug induced renal toxicity. So by definition, the nephrotoxicity is defined as 50% rise in serum creatinine over an period of 24 to 72 hours time frame, and a minimum of 24 to 48 hours of drug exposure. In this context, there is an event which is known as temporal relationship कि एक time course of duration of action is linked with the event of drug administration and the event of the injury which has been precipitated in the kidney or nephron. So there is a link between the administration and the appearance of this injury event. Now, pathologically or pathophysiologically, there are different type of demarcations for the injury. As per the adverse drug effect classification, the description of the drug induced kidney disease or kidney injury is divided into two types, type A and type B. Type A are usually augmented or dose dependent effects, and type B are idiosyncratic reactions which are allergic in response or hypertensive in sensitivity reactions in response. Now, as per the classification which is given by the kidney disease improving global outcome, the classification of the injury caused in the kidney is divided into acute, subacute, and chronic. The three sections of the injury are based on the time frame during which the drug has been exposed. So there is a temporal relationships. On the right hand side of the slide, now we will cover some basic mechanisms which are involved in the upsurge or the emergence of the injury which is caused due to drugs. So the first mechanism of drug induced renal disease includes alteration in the glomerular hemodynamics, and the main event in this is vasoconstriction, which leads to a disruption in the functioning of the nephron, which is the main unit of the kidney. The main drug class which act by this mechanism and contribute to the toxicity includes NSAIDs, ACE inhibitors, and ARBs, angiotensin receptor blockers. Now, the second mechanism includes the toxicity of renal tubular structure, in which there occurs an interference in the mitochondrial functions, which is mediated through the event of oxidative stress or the formation of free radicals. The class of drugs which shows this mechanism and are contributor of the drug induced renal disease includes the aminoglycosides, amphotericin B, antiretrovirals, and cisplatin. Now, other event or other mechanism which is a contributor of injury in the renal structure includes the inflammation in the glomerulus or renal tubular cells or the surrounding interstitium. In this, there are many events or many processes which contributes to the damage, which includes glomerulonephritis, in which the gold and lithium are the main agents. Other event is acute intestinal nephritis, in which the idiosyncratic type of reactions occurs, and the agent includes sulfonamides and allopurinol. And last but not the least, the chronic nephritis, which is caused due to aspirin and lithium. Finally, one of the event of the mechanism is a basic mechanism which is based on the solubility aspect, due to which there occurs crystals in the vasoculture of the nephron, leading to the damage to the nephron structure, in which the sulfonamides, due to their solubility profile, are a contributor of the injury due to drugs. Now, the next step in the management of drug induced kidney disease includes identification of features, and based on the identification, correlating the features with the factors, and based on this identification and correlation of the factors, finally preparing the management of the treatment of drug induced kidney disease. So in this slide we will deal with the features and the criteria which is utilized for identifying the type of injury, and we will also cover up some major factors which are major contributors in enhancing the drug induced kidney disease. So first, the criteria which is used to identify that the event is precisely due to the presence of drug in includes the criteria which is named as Bradford Hill criteria. In this criteria, there are four postulates of four different criteria elements which should be adhered for addressing a drug to be the major player in causing the drug induced kidney disease. So the first criteria would be the exposure must be at least 25 hours prior to the event. There should be a biological plausibility for the causal drug effect, metabolism, and immunogenicity. The third element is the main element which should correlate the upper two criterias and confirm the exposure event as well as the possibility of causal drug effect. So it includes the complete history of the patient, including the medication history as well as the previous medical history. It will contain all the details about the drug as well as the medical condition of the patient, so that we could correlate the relation of the drug with the current patient condition. Next, the last strength of the criteria which sets up the relationship between the event and the drug induced event is the attribute of drug, which is based on the exposure, duration, as well as time course of the injury caused by the drug. Now other basic risk factors which increases or promotes the drug induced kidney disease includes the age in which elders are more prone to get an event of or to manifest an event of drug induced kidney allergy due to the age related decline in the body function of kidney, as well as most probably majority of elders are on polypharmacy for the treatment of ailments like pain, chronic disease and all, in which there are use of drugs which have a potential to cause this drug induced kidney allergy. Second, the genetics, which includes the CYP chromosome types and subtypes, which facilitates the propensity of drug to cause a drug induced kidney disease. Next, the status of your kidney disease or kidney functioning, the status of your liver condition or presence of any liver ailment, and finally the cancers would be a major factors which would contribute to increase the propensity of drug induced kidney disease being manifested in a patient. Now, after going through the characteristics, features and factors, we will go through the management aspect of the event of drug induced renal disease, in which we will follow some of the required interventions which would help to decrease the impact of drug induced renal disease. So first intervention which we will do an assess of the renal function, which will tell us about the severity of disease. Next, first and foremost, we would do the event of withdrawing a drug if the drug is causing an idiosyncratic reaction or it is a event due to type B reaction. Next, in case of a type A type injury in which the event is due to accelerated pharmacological effect of drug, first we would try to decrease the dose so that the negative impacts of the drug are subsided. For this we would use some formulas which would help us to design the dose as per the clinical condition based on the renal or hepatic status of the patient. We would also assess the GFR status, the perfusion status, and we will finally monitor the levels of serum creatinine, which is the marker of renal function, as well as the input output, that what is the intake of fluids of the body as well as what is the urine output, which will indirectly tell us the condition of our renal system. With this, we have completed the topic of drug-induced renal diseases, in which we have covered basic introduction, epidemiology, major pathological mechanisms, as well as the management. तो इसी के साथ मैं आशा करता हूँ कि ये एक छोटी स्लाइड आपको एक ओवरव्यू देगी इस रिलेटेड टॉपिक में कि आपको रीनल इंड्यूस्ड ड्रग डिजीजेस के टॉपिक में क्या क्या चीज़ें कवर करनी है। ऑन द राइट हैंड साइड मैंने रेफरेंसेस दिए हैं और मैं आशा करता हूँ कि ये एफर्ट आपको एक गाइडलाइन देगा ताकि आप अपने नोट्स अच्छे से बना पाएँ। थैंक यू।